Inversion therapy is a method where you hang upside down, or you might be tilted at an angle. The main idea is to use gravity in a different way. Instead of gravity compressing your body, especially your spine, it helps to gently stretch it. This technique has been around for a long time in various forms. People use it hoping to find relief from certain types of pain or to gain other health benefits. It's a concept that might seem unusual at first, but many individuals find it helpful when done correctly and with proper understanding of its mechanisms. The core principle is simple: reverse the usual effects of gravity on your body. Several types of equipment can help you practice inversion therapy safely. The most common piece of equipment is an inversion table. This table allows you to strap yourself in securely. Then, you can slowly tilt backwards to your desired angle, even going fully upside down if you choose. There are also inversion chairs, which let you invert while seated, offering more support for some people. Some may also use inversion slings or gravity boots, which are often used with a sturdy bar. Each piece of equipment has its own features and ways to ensure you are secure, so choosing the right one depends on your comfort and physical needs. The fundamental concept behind inversion therapy is to counteract the daily compressive forces of gravity. Throughout our day, whether we are sitting, standing, or walking, gravity pulls us downwards. This constant pressure can compress the discs between our vertebrae, potentially leading to discomfort or pain over time. By inverting the body, the gravitational pull is reversed on the spine. This can create more space between the vertebrae. This gentle, passive stretch is what inversion therapy aims to achieve, offering a unique approach to managing spinal health and related issues for many individuals. When you invert, even partially, the goal is to allow your joints and especially your spinal discs to decompress. Think of your spinal discs as little cushions. Daily life can squeeze these cushions. Inversion aims to give them a break and a chance to plump back up. This process is not about aggressive stretching, but rather a gentle, sustained pull. It is important to start slowly and gradually increase the angle and duration of inversion. Listening to your body is key. The experience should be one of gentle relief, not strain or discomfort, especially when you are just beginning to explore this therapeutic approach. One of the most talked about benefits of inversion therapy is spinal decompression. As mentioned, gravity constantly presses down on your spine. This can lead to the spaces between your vertebrae narrowing over time. Inversion therapy may help to increase this space. This can relieve pressure on the spinal discs and nerve roots. Many people with chronic lower back pain report feeling relief after using an inversion table. This relief can be significant for some, reducing their reliance on pain medication or other more invasive treatments. It is a non-surgical way to potentially alleviate some common back issues. Improved circulation is another potential benefit. When you are upside down, gravity can help your blood flow back to your heart from your lower body. This might improve the efficiency of your circulatory system. Better circulation means more oxygen and nutrients can reach all parts of your body, including your brain. Some proponents suggest this can also help with lymphatic drainage, which is part of your body's system for removing waste products. While more research is always beneficial, the basic principles of fluid dynamics support the idea that changing your body's orientation to gravity can influence blood flow patterns positively. The gentle stretching during inversion can also help to realign the spine. Minor misalignments can sometimes occur due to poor posture or physical strain. By allowing the spine to stretch naturally with gravity, some of these misalignments might be gently corrected. This can lead to improved posture over time and reduce strain on supporting muscles and ligaments. It is not a replacement for chiropractic care if significant misalignments are present, but it can be a complementary practice. The feeling of elongation and space in the spine is often reported by users as a primary positive outcome. For individuals suffering from conditions like a herniated disc or sciatica, inversion therapy might offer some respite. A herniated disc occurs when the soft center of a spinal disc pushes out. Sciatica is pain radiating along the path of the sciatic nerve, often caused by disc issues. By decompressing the spine, inversion therapy can reduce the pressure on the affected disc and nerve. This may lessen pain and inflammation. However, it is crucial to approach this with caution and medical advice, as inversion is not suitable for every type of back problem or every individual experiencing these conditions. Beyond the direct effects on the spine, inversion therapy may also contribute to improved flexibility. The gentle, passive stretch experienced during inversion can help to elongate muscles and connective tissues. This is not just limited to the back. Muscles in the legs and torso can also benefit from this lengthening. Over time, regular inversion sessions might lead to an increased range of motion in various joints. This increased flexibility can make daily activities easier and reduce the risk of injuries caused by stiffness or restricted movement, contributing to overall physical well-being and agility in everyday life. Some people find that inversion therapy helps to reduce stress and promote relaxation. The act of inverting can be meditative for some. The gentle stretch and release of tension in the muscles, particularly in the back and shoulders, can be very soothing. This physical relaxation can translate into mental calmness. Reducing muscle tension can signal the brain to ease up on stress responses. As with any relaxation technique, the effects can vary from person to person, but many users report feeling calmer and less anxious after an inversion session, making it a part of their stress management routine. There are also claims that inversion can enhance mental clarity and alertness. This is often linked to the potential for increased blood flow to the brain. When you are inverted, more oxygen-rich blood may reach your brain cells. While this is a plausible theory, more rigorous scientific studies are needed to fully substantiate these claims for cognitive enhancement. However, anecdotally, some individuals report feeling more focused or mentally refreshed after inversion. This could also be linked to the reduction in stress and physical discomfort, which naturally allows for better concentration and mental function. Another less commonly discussed potential benefit is the relief of muscle spasms. Tight, overworked muscles can go into spasm, causing significant pain and discomfort. Inversion therapy may help by gently stretching these tense muscles and improving circulation to the affected area. This can help to break the cycle of pain and spasm. For athletes or individuals who engage in strenuous physical activity, inversion might be a useful tool for recovery and muscle relaxation. The passive nature of the stretch means the muscles can relax without active effort, which can be particularly beneficial when they are already fatigued or sore. While inversion therapy offers several potential benefits, it is not suitable for everyone. Certain health conditions can be made worse by hanging upside down. People with high blood pressure or hypertension should be very cautious. Inversion can significantly increase blood pressure, especially in the head. Individuals with heart conditions, such as congestive heart failure or a history of stroke, should also avoid inversion therapy. The changes in blood flow and pressure can put extra strain on the cardiovascular system, which could be dangerous for those with pre-existing vulnerabilities. Eye conditions are another important consideration. If you have glaucoma, retinal detachment, or any serious eye infection, inversion therapy is generally not recommended. The increased pressure in the head can also translate to increased pressure within the eyes, which can exacerbate these conditions. Similarly, pregnant women should avoid inversion, especially in later trimesters, due to the physical changes and potential risks to both mother and baby. It is always better to err on the side of caution when such significant health factors are in play, prioritizing safety above all else. If you are new to inversion therapy, it is vital to start slowly and carefully. Begin with a very mild angle of inversion, perhaps only 20 or 30 degrees, for just a minute or two. Gradually increase the angle and duration as your body gets accustomed to the sensation. Always make sure your equipment is properly assembled and that you are securely strapped in before you invert. Having someone nearby to assist you, especially during your first few sessions, is also a very good idea for safety and reassurance until you are comfortable with the process. Most importantly, always consult with your healthcare provider before starting inversion therapy. This is crucial. Your doctor knows your medical history and can advise whether inversion is safe and appropriate for you. They can help you understand the potential risks based on your specific health status. This step should not be skipped. Professional medical advice will help you make an informed decision and ensure that you are pursuing potential benefits without unknowingly exposing yourself to avoidable harm. Your health is paramount, and informed choices are the safest choice.